Hello and welcome to the 2025 Clients Only Update for Blackpoint Insurance. My name is Erin Ackenheil. I am your agent for your Medicare plans, and I'm happy to bring this update to you for 2025. And this is really an update based on earlier information provided earlier during open enrollment about all the changes coming up for Medicare for next year. So this is meant to be a highlight reel and update for what we already learned and other really important information going into next year to make sure you get the most out of your plan benefits. Again, my name is Erin Ackenheil. I'm the owner at Blackpoint Insurance. I'm your agent, and I'm so grateful for all of you sticking with me and being with me year after year, and hopefully you're enjoying the level of service that we're able to provide. What you'll see here is our team email, reservations@blackpointinsurance.com. This is 100% the best way to reach me and my team. We share that mailbox as a group, and there's always somebody monitoring that to make sure your needs are met. And there you see our office phone number, 415-328-0385. That's our number. Contact us. We're here to help and to guide you through all these different changes. It's been one of the most epically busy open enrollments that we've seen in a long time. And that's because there's a lot of changes this year going into 2025 related to Medicare. And in one way or another, it impacts absolutely everyone. So we want to make sure you're up to speed and keep you going on all that good information. So today's agenda, what we plan to cover is the A, B, C's, and D's of Medicare, the Medicare basics for 2025. I presented a lot of this information in October, but we've had some updates, some finalizing on terms of premiums and costs. So we're going to share that information and make sure you're totally up to speed. Then we're going to spend some time talking about Medicare Advantage versus Medicare Supplement or Plan G or F, so to speak, paired with a drug plan. What are the differences in the plans? What are the advantages, the disadvantages, and what are the changes based on the plan type that you're with? Then we're going to talk about prescription drug coverage for 2025. Whether you buy prescription drug coverage as a standalone product that you pair with a Medigap plan, or you get it embedded in a Medicare Advantage Part C plan, there are a lot of changes to the standard design for Medicare for next year, and it's impacting how these plans are administering that benefit. So we'll talk through that, what those changes are, and what you can expect at the pharmacy and kind of going forward. And then from there, in terms of the watch list, we're going to center around some hot topics, things like the trial right and the premiums for next year for Medicare, things like reconsideration of premiums for high earners. That's where we're going to place a little bit of emphasis to make sure you're up to speed on all the hot topics going into next year. So first up, we're going to talk a little bit about original Medicare. So original Medicare is what's known as A and B, Part A hospital and Part B medical. The vast majority of my clients have both original Medicare A and B because in order to get a Part C Medicare Advantage or a Medicare Supplement Part D combination of plans, A and B is kind of that price of admission. That's how you get it. You have to have and maintain your Medicare A and B to be a part of the additional coverage in the Medicare program. And Part A hospital, for most of you, you actually are not paying a monthly premium for this, not because Medicare Part A is free, but because you already paid while working. When you work 10 years or 40 quarters paying in, you don't pay again for Medicare Part A. However, when you use your original Medicare Part A, there are some costs associated with that. And those costs tend to go up every single year. Now, you're a bit sheltered from seeing those increases because if you're on a Medicare Advantage plan, you're just paying set specific copays for Medicare Part A benefits. And if you're on a Medigap plan, your supplement is actually covering the gaps in original Medicare. But what's important to know is there are changes to this, and that impacts the cost you pay. It impacts the benefits that you're able to receive from your existing plans. So some of the changes for next year include an increase to the inpatient deductible. The first minute deductible in the hospital under Medicare Part A is going up to $1,676. Thank goodness you've got coverage for that. And if you're in the hospital for a lengthy stay, which believe it or not does happen, starting at day 61, the copay for hospital days are $419 per day. And if you had to be there more than 90 days in a row, starting at day 91, it would be all the way up to $838 per day. Really expensive. A lot of people are surprised to know that under original Medicare, you can actually run out of room and board covered in the hospital starting at day 151. Most of the Medicare Advantage plans cover you unlimited in the hospital. You may have some daily co-insurance. And the Medigap plans give you an additional 365 lifetime reserve days, which would mean you'd have to be in the hospital 515 days in a row to actually run out of hospital coverage with a Medigap plan. So you've made good decisions for your healthcare, having something to fill the gaps in original Medicare Part A. Also under the Medicare Part A umbrella, there's skilled nursing facility care. This is designed to be transitional from hospital to home. Oftentimes you'll go to skilled rehab where you're getting 24/7 care while you're recovering. Days 1 through 20 are covered by original Medicare 100%, but you are covered longer than that. And beginning at day 21 through 100, it's actually going up to $209.50 per day. Some of the Medicare Advantage plans out there reduce that amount. The Medigap plans like Plan G or F eliminate that daily co-insurance for days 21 through 100. So the coverages you have are helping to fill the gaps in what original Medicare doesn't cover. It's important to note that under original Medicare, if you go over 100 days, or if your level of care drops below a skilled level, original Medicare is no longer going to pay for that, nor would your Advantage plans or your Medigap plans. So that's considered what's called long-term care, which is a separate type of policy that's not offered through your Medicare program. So it's just important to have a plan for that and make sure you understand that. Medicare Part B is the other half of original Medicare, and it stands for Part B medical insurance. And this is talk about everything with the word physician, your doctor's care, emergency room, ambulance, physical speech occupational therapy, things like durable medical equipment or MRIs, all Medicare Part B. Super important coverage to have. And Medicare Part B does carry a premium. For most of you, you're paying what's called standard premiums for Medicare Part B. The standard premium for Part B is going up effective January from $174.70 per person per month to $185 per person per month. Now, if you're drawing Social Security, they're going to automatically deduct that from your Social Security check. And if you're not, they typically bill quarterly for that. Now, some of you have help from the state and have a state program that helps you to pay for that $185. You probably have low income and low assets if you're having a program like that. On the other hand, some of you are assessed something called IRMA, which stands for Income Related Monthly Adjustment Amount. Medicare has released their IRMA figures for 2025. I'm attaching them to the message that I send out to you today so you can see exactly what those costs look like. And if your income for 2023 was greater than $106,000 as an individual, or greater than $212,000 as a married couple, you're being assessed one of these IRMAs. And that can be significantly more money for your Medicare based on your prior income. Now, there is a reconsideration process that's outlined in the email that I've sent to you, and we'll talk about it a little bit later in Hot Topics. It's possible to get your premiums reduced based on your current income level if you have a qualifying reason. Also under Medicare Part B, there are gaps. And one of the most common gaps is the Medicare Part B as in boy deductible. Fortunately, it's pretty small, but it is going up for next year from $240 to $257. For those of you who are on Plan F, like Fantastic, you continue to pay no deductible. And you're on Plan F because that plan was available to people who had Medicare prior to 2020. So you're on that plan, it continues to have no deductible, and you're sheltered from this increase in cost. For those of you who are on Plan N or G, you have a Medicare supplement plan on N or G, you do have to pay the deductible, and this means a $17 increase out of your pocket before you access other benefits for 2025. So that's a bit of a jump. And for those of you who have a Medicare Advantage Part C, the good news is the Part B deductible is eliminated and you simply pay the copays associated with the plan that you've chosen. Also under Medicare Part B, there's a 20% coinsurance with no ceiling. And I think what this does is it reinforces your decision to either have an Advantage plan or a MedSup and D to insure against paying that 20%, which could be catastrophic in terms of cost if you didn't have the additional coverage. Also under Medicare Part B, if you're in a situation where you see a doctor that takes Medicare but doesn't accept the reduced pay schedule, it's possible that a balance bill would be created. If a balance bill is created, that's called excess charges, and that bill is passed on to you unless you have a supplement plan like F or G that covers it, or you're on an Advantage plan where it doesn't exist, right? Because you just have your copays with that specific kind of coverage. The other big thing with Original Medicare, as you probably know, is prescription drug coverage is not included. So you have to buy either a standalone prescription drug plan that you pair with your Medigap, or you get prescription drug coverage embedded in your Medicare Advantage Part C plan. So you don't buy it directly from Medicare, and it's not part of the Original Medicare program. Also, Original Medicare isn't going to cover things like dental, routine hearing exams and hearing aids, routine eye exams and glasses. You're on your own for those benefits.